Well, hello and welcome. It's been a wonderful week. It's been a week filled with mixed emotions. We're dealing with galamsey, we're dealing with governance issues, political issues, sentimental issues. Kofanochi was back on the scene. This was a beautiful auction to make sure that we have money, to make sure that mothers don't die and babies at least have a safe surrounding. And whilst all this is going on and you're dealing with traffic and the menace that it comes with, stress of work, what happens is that it affects your blood pressure. Your blood pressure, the stress during the blood pressure. But to top it all off, us Ghanaians from nowhere, the more we go to school and the more elite we become, our eating habit becomes completely atrocious. Now you don't want just the green, simple contemporary. No, that's a mark of poverty. You have to douse it with red oil. It needs to be swimming. Have 2-3 eggs in there. Have the Kobe, salted Kobe, and everything in there. And that shows you your status. When the food is served, everybody knows that that's it. Then on Sundays, those of us, go to the mutual joint. And you cannot imagine how much calories one can pack in a bowl of food unless you visit an mutual joint on Sunday. And then we top it all up. But then there isn't enough time to exercise. Of course, you go back late, and I'll get home, late, wake up early, and, have the excuse. And the best time to start doing anything is tomorrow. So you start your diet tomorrow, you start your exercise tomorrow, and that tomorrow never seems to come. And here we are, a country, laden with blood pressure, timing bomb all over us. One of the medical menace looming around the corner is blood pressure. So as the week is ending and we are all at home, I thought, why not? Why don't we find a way to deal with blood pressure? Those of you who haven't got it, how do you stop it? Those who have it, how do you deal with it? And that's what I think will be a perfect way to end the week. My name is Nana Nsakwao, Chief of Akomo Edumasa. I have a lot of pressure, but my blood pressure is medium high. So stay tuned. When I come back, I have one of the finest doctors. I think we have to adopt him to be the PM Express doctor to teach us as how to do. And this time I open the phone lines quickly so you can call in, you can share your problems if you suspect you have anything. Don't move, we're coming straight back. Well, thank you very much for staying. Dealing with blood pressure with me in the studio is PM Express doctor. This is by force coercion. Dr. Joseph Ankama, who is a cardiologist. Doc, you're welcome.
Thank you.
Good to see you.
Good to see you again.
Good. I know my audience really, really love you because you have that doctor touch. You see, you're a called doctor, not a paycheck doctor. Yeah. a called doctor. Yeah. Doc, first of all, let me say, what is blood pressure?
Thank you. Thank you for inviting me here, and it's always good to be here. And good evening to my viewers and your viewers too. So I'm happy to discuss blood pressure.
Sure.
And in about a couple of weeks, actually less than a couple of weeks, we'll be celebrating the World Hypertension Day on the 17th. So it's good that Joy TV has picked this up to start priming Ghanaians towards this. So blood pressure, it's nothing but just the pressure on the walls of the arteries, allowing the blood to circulate. So everybody needs an amount of blood pressure to allow blood to move from the heart all the way to the distant organs. So day by day, we have our blood pressure fluctuate up and down. So there's no particular time that you have the same blood pressure throughout. Especially at night, your blood pressure is at its lowest peak. And then during the day, the blood pressure goes up. So blood pressure varies, and it also varies depending on your anxiety level, on your stress level, on the workload you're putting on your body. So everything affects blood pressure. If you begin to exercise, your blood pressure goes up because the heart has to pump blood to all the organs, especially the muscles, to allow you to exercise. If you're frightened and you're about to run, your blood pressure goes up. So blood pressure is needed. However, the problem becomes a serious condition when the blood pressure goes beyond what it's supposed to be. So usually, we want your blood pressure to be less than 140 systolic and 90, below 90 diastolic. So anytime you check your blood pressure, there are two numbers. There's a top number, which is a systolic blood pressure, when the heart contracts and pumps the blood out. And the diastolic is when the heart relaxes to fill and get more blood.
The bottom?
The bottom number.
The bottom one is when the heart is taking the blood in?
In, and it's relaxing and getting ready to pump again. And the systolic is the top number, when the heart pumps the blood out, so the pressure goes up. And then when it relaxes, the pressure goes down. Ideal blood pressure is 120/80. That's the ideal blood pressure. So there's a gray zone between 120 and 140. This gray zone is called prehypertension. So that's the prehypertension period. So if your blood pressure is 119, 120, that is perfect. But as soon as your blood pressure begins to go up, you know that it should be 120, but why is it going to 130? You have to contact a doctor. Not necessarily to begin treatment in terms of medication, but begin treatment in terms of lifestyle changes. Yes.
I see. This 120/80, does age matter? I mean, what if you're 60 years old? What if you're 65? Should you still be 120/80, or at that time you're allowed to go a bit higher?
So the blood pressure, like I said before, varies with time of the day, your activity. It also varies with age. The current guidelines allows senior citizens an amount of blood pressure. So for you and I, anything beyond 140 systolic is considered, or 140 and above is considered hypertension.
Okay.
For a 70-year-old, I would take 150 to be his cutoff. And that is what most guidelines will allow. So for the senior citizens, the blood pressure goes up because the vessels become stiff, because they're older. So a BP in a 65 to 70-year-old man, 150, is allowed by most physicians, currently, by current guidelines. But it changes because we don't know what is the ideal blood pressure. We just go by guidelines. Several years ago, when we were not born, probably, if you had a blood pressure of 160, it was allowed. Currently, if you have a blood pressure of 160, it's not allowed. So the guidelines also changes as we get to know the condition. That's why the guidelines keep on giving us a range of targets BP control.
What if you're pregnant?
If you're pregnant, most women have low blood pressure to begin with. So most women, young ladies, will have a BP. I said ideal was 120/80. But most young girls who have, young women who have BPs in the range of 90 to 110. It's not uncommon.
Okay.
Yes. So when they become pregnant, the BP stays around that same zone. Sometimes it goes up to 120. But as soon as it shoots up beyond 10 points, 20 points, so assuming the baseline is 90, and the BP suddenly shoots to 120, if you look at the categorization, it is normal, but in that woman, it's probably not normal. It's shooting up too fast. So in pregnant women, a BP that is shooting up, going up too quickly, has to be taken serious. And it can lead to certain conditions, and it's fatal to both the mother and the baby. One of the conditions is called preeclampsia,
okay,
or pregnancy-induced hypertension. So when a pregnant woman is being monitored, that's why they see them regularly. They see that the BP begins to go up. They call them back sooner to monitor the BP, make sure that it doesn't go too far up.
And in children, let's say, 14, 12, I mean, or at that stage, you probably don't need to check your BP, do you?
I wouldn't say so, because there are 14 years who are bigger than us. You know that?
Yeah.
Yes. So currently we have adolescent hypertension, we have teenage hypertension, and the scary aspect is these people grow up into young adults. And I think the discussion, we have to talk more about the young adult as the most risk person for having BP, because then he has to live with BP throughout his life. So teenagers who are obese, who are not active physically, are prone to having hypertension. So we're having young children becoming hypertensive.
Look, I mean, maybe let's say in our grandparents' era,
yes.
And even though we always say, I haven't seen any statistics, but it is believed they did not have as much hypertension as we do. Number one, is that a fact? And two, could it only be because of our eating habits, if it is?
I would say yes and no. Why yes and no? We were not checking BP at that time. So you can't categorically say they did not have BP. But however, the books document that when a white man was here, Africans did not have much of blood pressure. However, with time, the blood pressure prevalence has gone so high that we've surpassed almost everybody.
Is it the introduction of canned foods and stuff?
So it's a combination of a lot of things, including the canned food. So one is we've lost that physical activity, which our grandparents used to endure. They used to walk miles, they used to farm, and be very physical.
Roll their canoes.
Exactly. But most of us are riding motorbikes, right? And then we're having cars. So you can imagine going from Circle to, say, Kolebu. Nobody walks these days.
No.
Most people will just take a trotro and then they're gone. So that's number one, physical activity. Number two is our diet. Our diet has changed tremendously. The food we used to eat had less salt content, had less oil content, had more fiber. Currently, we're eating finer food, refined food, with a lot of added components, especially salt. So if you eat food in a day that has more than 2 grams, you are just throwing yourself into the pathway of hypertension. So ideally, your salt intake per day should be less than 2 grams.
What's the average salt intake now? Has anybody done this?
In Ghana?
In Ghana.
They haven't measured it, but most people, when the WHO quotes, is way beyond what the recommendation. Some quote 3 times. So that means that we're eating about 5 to 7 grams of salt a day.
I mean, Kobe alone will give you 20 grams.
Oh, that will give you so many grams.
Yeah.
And then talk about this fast food. Fast food with noodles and salt. Literally, it's noodles and salt and pepper. That gives you a load of 5 grams right there. That's one diet. Then you add light soup. So that gives us a lot of problems. The other problem that we are facing is obesity. So I talked about physical inactivity, talked about salt intake, our diet, and then obesity. So our weight, most Ghanaians are becoming heavier, pot belly and that sort of lifestyle. The next one is alcohol use. So a lot of young adults are indulging in alcohol. And recently, one of the alcohol producers was in trouble because teenagers got
the
involved.
binge drinking.
Yes. And so alcohol gives you a lot of solute load and volume and increases blood pressure. So that is one of the problems. In addition, the stress we are enduring now was taken up in the yesteryears by social measures, social network, which we've lost. So most Ghanaians have become individualistic, as opposed to our grandparents who had social network who could bounce their problems from household to household. Currently, you have a problem, you deal with it by yourself. So that puts a lot of stress on us. So it's a myriad of problems that leads to the blood pressure. It's not just one thing.
I'm going to come back to this social problem issue, but you know, we are the assumption that, you know, Kobe is, because it's dry fish, that it's supposed to be healthy. So which is which? I mean, is it just the salt that's killing it, or is there something else?
Right. So the people who designed Kobe had an intention. One is salt is a preservative. It kills bacteria. So no bacteria wants to come to your fish when you preserve it in salt. That's why brine is used to preserve a lot of canned food. So Kobe is very delicious because there's so much salt in it with protein. So, but the salt content is a problem. So you could use Kobe to actually prepare stew without adding salt. But some people still add more salt to it. So Kobe is probably good for preservation, but when you want to use it, some people will prefer you soak it, get the salt out of it, then you can use little bits for the flavor and then the taste. But if you indulge too much, that becomes a problem. So all canned food has too much salt in it. All canned food, because of the preservation used to keep the food from getting spoiled.
Okay, I'm going to give you the number now, because as far as blood pressure issues concerned, I know millions of us have issues with blood pressure. And after the number, my question to doctor is, you know, there are people who says my blood pressure simply won't come down. I'm walking, I'm exercising, I'm taking my tablets, but the pressure just won't come down. What is that? But the number is 0302 211 691. 0302 211 691. You may have an issue you want to inquire about. Doctor is here, and doctor is very happy to help you. Before doctor goes, I need you to give us your number so that people can come to you for more help. 0302 211 691 and 692. Both numbers will come, and you can ask doctor whatever question relating to blood pressure. But doc, you know, you hear this thing that my blood pressure won't come down. What do you mean the blood pressure won't come down? They are eating right, they are walking, taking their tablets, and they are just struggling to bring the blood pressure down. What's the cause of that?
Right. So blood pressure won't come down has many implications. One is the blood pressure measured rightly. Two, are you anxious when the blood pressure is being measured? Three, is the equipment you're using the right equipment? Four, are you taking the medicines the way the doctor told you to take it? The fifth one is, are you under undue stress and carrying on with all the bad activities the doctor said don't do? For instance, alcohol use, stress, building 10 houses when you should be focusing on only one house, having to run 3 jobs and sleeping less. These are all things that you have to take into account. So before you say your blood pressure is not coming down, you have to sit down with your doctor. It's only the doctor who can tell your blood pressure is not coming down. And sometimes we have to make sure, one, you're compliant. Two, you are on the right doses. Three, you are doing the dietary supplementation, not eating too much salt. Begin an exercise program, relaxing, not drinking alcohol. So when you do all of this and you are on 3 medications, one of which should be a diuretic, only then will you say your blood pressure is not coming down? But if you're only on a BBO, let me use BBO dose of a medication, and you're saying it's not coming down, it is not so. So I think before you say your blood pressure is not coming down, you need to sit down with your doctor, understand the numbers. Actually, the theme for this year's hypertension is know your numbers, know your blood pressure. So you need to know your numbers, the trend it, and see how is it, how does it, your lifestyle, how does it affect you, your anger level, lack of sleep, too much workload, how does it affect your blood pressure? The medications you are taking, are they the right doses? Are they up to 3 medications? Does it include a diuretic? When that happens, before you can say the blood pressure is high and it's not controlled.
Okay, let me take a quick pause here, and then when we come back, we'll get to the phones, and then you can also, call in and see of all the stress that we put you through with bad news and anxiety news this week, how it is that we can bring your blood pressure down. Don't move. Well, thank you very much for staying, dealing with high blood pressure. 0302-211-691 or 0302-211-692. Maybe you have a question that I haven't asked. Why not call and let's see what doctor can do to... okay, let me go to the phones and speak to Douglas. Hello, Douglas. Douglas. Can Douglas hear me?
Yeah, boss. I want to ask doctor.
Mm-hmm.
People are born with normal ear. I hear you. You always say people are born with hot-tempered. I want to know how all those things attribute to the blood pressure.
People are born with what?
Hot-tempered.
Oh,
that's the way we are come.
Oh, okay.
I want to know if all those things are attributed to hot-tempered.
Okay, so this is hot-tempered. Okay.
So I want to know that all those things is attributed to the BP.
Okay, Douglas, thank you very much. We'll put that down. 0302-211-691. Hello, Kwesi Kitua.
Yes.
How can doctor help?
Yeah, I want to find out from you, from doctor.
Mm-hmm.
I'm told that if you have hypertension, you must stay away from sex.
Okay.
Whether it's true or not.
Stay away from sex. Okay. Kwesi Kitua,
Okay.
I'll get Doc to answer that. 0302-211-691. Hello, Mohammed.
Hello.
Mohammed.
Yes.
Good. What's your question?
Yeah. Good evening.
Good evening.
Yes. Thanks for the opportunity given.
Good.
Yeah. Please, I want to ask doctor. Yeah, I have an old woman who is having this problem.
Uh-huh.
And then, what kind of food does we need to give her? And then the another question is that with regards to the numbers that you are given, the normal either sometimes we see 130 or the denominator would be 180, and then sometimes and then the numerator would be 130. So I don't know which actual value should one pick as a normal blood pressure.
Okay. Now so I've got 3 questions. I get doctor to quickly rush through the 3, and then I'll come back to the phones again. So Doc.
Okay. So we'll take them from top down. First down. Douglas mentioned that if you are born with hot-tempered behavior or attitude, will you have blood pressure? Yes. So anger management is a key to succeeding in life.
So in that case, do they need anger management or they need pills?
They need anger management.
Okay.
So hot-tempered means you have a lot of chemicals that make you very aggressive. And one of the chemicals is called adrenaline.
Okay.
And adrenaline will make your blood pressure go up.
Oh.
So if you are quick to temper, that's what the Bible says, don't be quick to temper. So keep it down, learn how to control your temper. Those people, if you follow them, they eventually have hypertension. And some of them actually get into stroke if they become very, very angry. So because during that temper tantrum, the blood pressure goes up so high that they can get a stroke. So if you are hot-tempered, it would be nice to see a psychologist, see a doctor, see a counselor, maybe your pastor or malam, to see whether they can have a way of keeping your temper down. Kwesi Kitwa, I hope, Douglas, you've understood what I said. Kwesi Kitwa mentioned that you should stay away from sex if you have hypertension. That is categorically no. That is false.
Kwesi, that's good news.
Kwesi, do not stay away from sex. Just to add to this, some people think if you take BP medicine, the BP medicine makes you impotent. That is also false. The current medications that we have should not make you impotent.
Okay.
It is better to prevent stroke and be impotent than to have stroke and not be able to have sex.
Okay.
You understand? So I think the story about sex is wrong, and the medications do not cause impotence.
But would sex be classified as an exercise?
Yes. So sex is actually an exercise. It is the only exercise where a lot of muscles are used at the same time, the whole body. So some people feel if you have sex regularly, it helps your health. So, however, what I want to emphasize is that if you are on BP medicines and you're beginning to have erectile dysfunction, see your doctor. Probably it's not the medication. It's likely the BP itself, the stress you're going through, your lack of finances, a lot of things. So the doctor will be able to help you. So we can add medications like Viagra or sildenafil, that's the other name, to your medications. And you can take them with the BP medicine, and that will enhance your sexual activity.
Just quick, I mean, Viagra and PP, is that not scary? Because Viagra, pumps your blood up?
Not necessarily. Not necessarily.
Okay.
So your BP is well controlled with, say, 3 medications, and you add a Viagra to feel happy at night. That's doable.
The last one before I go to the phone calls.
Yes,
is
Mohammed,
yeah.
about the old lady with blood pressure. So, Mohammed, the normal blood pressure is below 140, the top number. The bottom number below 90. So if your old lady is 180 over 130, that is very, very high. That is very, very high. So remember, normal blood pressure, ideal blood pressure is 120 over 80. You can allow it all the way to 139, but that's prehypertension. All the way to 89, that is prehypertension. Beyond 140, beyond 90, that is hypertension. The food your old lady should be eating, it depends on the person and depends on whether she's taking medication. But generally, we don't want the old lady to be on medication, on salt. So you can decrease the amount of salt, but you have to be careful that she refuses to eat altogether. That's why you need to see a doctor, a nurse, to counsel the lady, and then gradually cut off salt from the diet. If she can. If she cannot, she should reduce the quantity. But otherwise, she should eat a balanced diet which contains vegetables, proteins, beans. No vegetables is a problem in Ghana. But a lot of the local people have leaves, alefu and then bitter, which is a northern leaf, which is really good. Kontomire, very, very good. So they can actually eat these with little salt in them.
Let me go to the phones and speak to Solomon. Hello, Solomon.
Hello.
Hello, Solomon.
Hello.
Hello, you're on air. Let me hear your concern.
Hello.
Let me hear your concern, Solomon.
Yes. Hello. Yeah. Good evening.
Good evening.
Yeah, good evening, sir.
Yeah, my problem is about my breathing. I have difficulty in breathing. I have difficulty in breathing.
Okay. I think I'll let Doc ask you, one or two questions because it's a bit. Yeah.
Right. So is it always there or it goes and comes?
Shaking in my is it the veins or?
Your difficulty in breathing, when does it come? Is it when you're working, when you're walking, or is when you're sitting?
It's always there. It's something that is problem. It's always there.
And you're not asthmatic?
Yes.
Are you asthmatic? Please, Solomon, are you asthmatic? Okay, so
no, please.
You're not asthmatic.
No, please.
Okay, so difficulty in breathing is a symptom because
No.
I'm trying to explain your symptom. I'm trying to explain.
Hold on one second.
Yes.
Solomon, you need to reduce your TV and then listen on the phone because there's a delay. So shut the volume off from the TV, just the volume, and then listen via the phone so doctor can give you an advice. Okay, please.
Okay.
So what's your question about your difficulty in breathing?
Okay. Hello?
Yes. What is your question?
I have difficulty in breathing, and then sometimes I can see some shaking in my veins, or I don't know whether it's actually some part of my body will be shaking.
Okay.
Some part of my body will be shaking. I can feel my veins or the arteries be shaking.
Okay.
And then the difficulty in breathing is heavy when in the night.
Okay. Thank you very much, Solomon.
Okay.
So when you have difficulty in breathing, it means there is a problem with oxygen exchange or lack of oxygen, or your heart is not pumping well, or your lungs are not working well. These are all possibilities. But it's difficult to know without seeing you and without examining you. The shaking of the veins and the arteries could be maybe you're tremulous or your blood pressure is high. So it's really difficult. But what I will advise you is, if you have national health insurance, go visit your district hospital or polyclinic, and then they'll evaluate you. If you need a specialist, they can refer you to CS at Kolebu at the Department of Medicine. So we can examine you and give you a thorough consultation. But generally, when you have difficulty breathing, it could mean one of these things: lack of oxygen, your heart is not pumping well, or your lungs are not working well. It's difficult to know what is going on until you see a doctor, and you may need chest x-ray and some cardiac tests.
Okay, so 0302 211 691 0302 211 691 or 692, and Doc will definitely help you with this. Doc, should there be like a national consensus on healthy eating? Because I don't think healthy eating is being promoted as a national agenda enough.
Yeah, I agree with you. Healthy eating has not been really a national. We have so many things to deal with, to be honest with you, health issues. But I think Ghanaian food is really good too. So the taste is good. So we have to debate as to how to let our culture be seen through our food and also eat healthy.
I mean, sometimes the food, like you mentioned contumely, which is fantastic.
Yes.
But by the time the contumely is boiled for 30 minutes,
exactly,
before they mash it, put it again in oil, fried for 3 hours,
yes,
and Kobe it and this and that, and by the time it comes, that contumely is as dangerous as anything else.
Exactly. I think my advice is that you should eat all of our Ghanaian food in moderation. In moderation. Less salt, eat everything that your mother showed you how
Doc,
to eat.
let me go to Augustina from Prestia. Augustina.
Hello.
Hello, Augustina. Good evening.
My name is Augustina. Please, I think I missed the beginning of the discussion, but I want to know if the high blood pressure is hereditary.
Okay, Augustina. We'll answer that. And then who do I have next? Hello, Justin.
Yeah.
Yeah, let me hear you.
Hello?
Yeah, doctor's listening to you.
Yeah. I'm also having a little problem.
Yes, waiting to hear.
Hello?
Yeah, let's hear you.
I said I have a little problem and I just want to get you informed.
Okay.
My problem is, most of the time, you see, part of my body will be shaking, specifically the lips of my eye, on top of my eye. At times, it will be shaking, and on my chest, where the heart moves, it at times shake and then stop.
Okay, thank you very much, Augustine. I get Doc to answer that. Do we have anybody else on the line? Okay, Doc, so we have these two.
So Augustina's question was whether blood pressure is hereditary. It is not really hereditary like we know it, but it runs in families. Okay. So there is something called the transmission of a condition from mother to baby or from father to baby. Blood pressure is not like that. However, if you have blood pressure in your family, it's likely you're going to have blood pressure. So it's a combination of genes that are not directly transmitted. However, the fact that your father has blood pressure means that you are predisposed to getting BP. But if you do the right things, you're likely to keep it down.
I was just going to ask that if you live, a very healthy life.
Exactly.
Is it likely, or you can definitely stop it?
Likely.
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 What do you, I mean?
It's
so
not 100%.
It's not 100%.
It's not 100%.
If you're an athlete,
it's not 100%. So I have a family where they do everything right, but everybody has blood pressure. Everybody has blood pressure, and they are skinny.
So what then induces that blood pressure?
So it's sometimes if you look at the way blood pressure comes, there are only a subset of people where you can pinpoint and say there are causes of blood pressure. For instance, a narrowed artery that supplies the kidney. That can cause blood pressure. And if we fix it, the blood pressure goes away. Or if you have a tumor that produces adrenaline, when the surgeons go in there and take that tumor out, your blood pressure is cured. Outside these, everybody else blood pressure is called essential. So that's about 95% of us who have essential blood pressure. And it's a combination of it running your family, the diet you eat, the stress you're going through, the alcohol you're drinking, and your weight. So it is not just one thing.
Okay, let me give you two more questions, and then we answer that and the other one. So I have Baba on the phone. Hello, Baba. Hello.
Yes, sir. Good evening.
Good evening, Baba. Let's hear you.
Yes, sir. So I'm having hello. Good evening.
Yeah, let's hear you. Okay, let's go to Peter.
Hello. Good evening.
Yes, Peter.
I want to ask Doc, what happens if your BP drops below the 120 and then the 80?
Okay, so what happens if you have low blood pressure? Okay, thank you, Peter. So we have Peter. And
so let me go back to Justin, shaking eyelid and then shaking chest. This could be tremors. It's something called tremors or contractions of the eyelid. So rapid contraction of the eyelid could be as a result of stress. Some people, they blink a lot, or they have this sharp, fast movement of the eyelid because of stress. If it's occurring a lot of times, it's good to consult a neurologist. So first see your family doctor, and then he can examine you and run some tests. Some people may have certain type of seizures that can occur like that. So it's always good if you have these types of movement and you're not under stress to consult a doctor who may finally refer to a neurologist to see what is happening. Why is that side moving so fast? Why is the muscle contracting so rapidly? It could be a seizure or just under stress. For Baba, who couldn't get his question. Peter's question was if the BP falls below 120/80. Now, if you're on medication and the BP falls below 120/80 and you're not symptomatic and it's staying the same, that is perfect. So we can allow blood pressure to drop to about 100 systolic. It can drop to about 60 systolic. Below 100 over 60, then it is too low for your body to take. But as I told you, women can have blood pressure of 100 and they're okay. So long as you're not symptomatic, meaning you're not dizzy, you're not tired, you don't feel sleepy, you're not weak, and the blood pressure is staying 110, that is really good. Now, if you're on medication and the blood pressure is staying always low, the doctor will probably have to take you off some of them. Don't take them off yourself. The doctor will know which combination to use and then elevate the blood pressure back to about 120, 130.
Doc, there are a few people who think, look, you wake up today, you check the blood pressure, 120/80, spot on. Well, then today I won't take my tablet. Tomorrow you check it, 120/80, yeah, I'm fine. 121/80, look, I'm still good. And then maybe come the end of the week, it goes to maybe 130/90. Okay, then I'll take my tablet. I mean, should you also regulate as well? If it's fine, then stay off the tablet a little bit so the body doesn't get too used to the tablet.
That is a trick question. Because
let's go to Isa and then we come back.
Okay.
Hello, Isa.
Good evening, sir.
Good evening.
Please, I want to ask doctor, if at the age of 25 to 30, you have a blood pressure of 140/90, how would you classify it, and what would be your precautionary measures, or what should you do at that age with that kind of blood pressure? Thanks.
25 to 30, 140/90. Okay, Isa, thank you.
Okay. So I said your question was tricky.
We have Bernard too. Hello, Bernard.
Hello, Nana.
Yes.
Good evening.
Good evening.
I'm speaking from Takwa.
Okay, Bernard.
I want doctors to clarify the amount of salt that we should take each day, maybe per spoon.
Oh, okay.
Is it teaspoon? How many spoons? Or the 2 grams that he is explaining, old ladies, old mothers.
I know. We don't have a scale in our kitchen.
How much salt should we take a day?
Okay.
Or should we add to our stew or our soup? Thank you.
Thank you. And then, okay, then we have Matthias. Hello, Matthias.
Yes, please. Good evening.
Good evening, Matthias.
Yeah, please, I want to ask him this question. I want to ask whether the drugs are... Hello?
Yeah, well, I'm listening.
Yeah, the drugs are this very drug, metadopa, and then nifedipine, whether it can give a side effect.
Okay, thank you.
Okay.
Loaded you.
So your question was about whether we can take the medicine as needed. Only few patients who know what they're doing should be allowed to do that. Because one is, how often do we remember to check the BP? So if you say you're checking it every 3 days, or sometimes you forget, then it is not the best option. I have a patient who probably is listening. She's been able to modulate her BP to the level where she can take the BP medication when the BP is about to go up, and it keeps it stable. And for the past 2-3 months, she hasn't taken the BP medication. But that person has been taken through schooling to a level where she understands her body, she knows what to do. But until you get to that level, do not try it. It's better to talk to your doctor and then have the BP medication lowered to keep the BP always down than the hikes. The problem of stroke comes with the hikes. When the BP shoots up suddenly, that's when people get strokes. So I wouldn't advise it unless your doctor discusses with you. With Isa's question, between the age of 25 and 30, that is really the saddest point that we have to talk about. Young adults from 18 to 35, 40 are becoming hypertensive. In a study in the US, 19% of the young adults had high blood pressure. So 1 in every 5 young adults has high blood pressure in the US. And that's among blacks. So that means that if you move it to Ghana, 1 in every probably 1 in every 5 young adults has high blood pressure, and that is really bad. So 140/90, whether you are 18 years, 15 years, 20 years, 40 years, is very high. So at this point, you may not be put on medication, Isa, but you'll be told to begin an exercise program. You'll be told to start decreasing salt. You'll be told to relax and relieve stress. You'll be told to reduce alcohol. Isa, probably you don't drink alcohol, but if you drink alcohol, you have to stop alcohol. Then they'll monitor the blood pressure. If it's not coming down, they'll put you on a single medication. At this level, most likely a single medication will work. Bernard from Takwa talked about the salt. So 2 grams is about 1 teaspoon. So
that's what you allow the whole day.
The whole day.
Hey, so if you have soup, stew,
yes, but how much do you put in stew? And the stew, you're not going to consume the whole stew that moment. You're going to put a little in the rice. So if you put, even if you put 2 teaspoons in stew, that stew is going to last you 3-4 days.
So a little portion.
A little portion. Okay. A little portion. And then you don't put too much in the rice or the yam, just a little bit to taste. And actually, those who've been able to stay away from salt feel food tastes better without salt. And they don't even want to touch salt any longer. So 1 teaspoon of table salt is 2 grams. It's about 2 grams.
That's what you allow the whole day.
The whole day.
And that's safe.
That is safe. Actually, if you even lower it, it makes it better. So 1.5 grams, that's maybe 2/3 of
How about stopping altogether?
That is even perfect. So you can use substitutes. So for instance, carrot has some sweetening in it. So if you add carrot and a little bit add apple to certain types of food, you can taste the food without salt. So there are salt substitutes that you can buy in the market. In Ghana, we don't have too many of them, but abroad, you could get salt substitute, which do not have sodium. The main thing is the sodium. It doesn't matter whether it's sea salt or rock salt, all of it is bad.
Okay.
All of it is bad. And so Matthias medication, metal-dopa is a very good medication, but it's very old. It has side effects for men. So I don't use it. And besides, it doesn't benefit the person. The only benefit you get is to lower BP. So metal-dopa is used mostly in women, especially pregnant women, because it doesn't affect the baby. So metal-dopa in men, you shouldn't, unless you are reacting to all the medications, then we're pushed to the wall. So it should not be used at all. But in women, we use it very commonly in pregnant women because we don't want anything to hurt the baby. Okay. Metal-dopa does not hurt the baby. So it causes impotence in men. So men who are on metal-dopa, talk to your doctor to switch you to a beta blocker, a calcium channel blocker, an ACE inhibitor. These are all forms of medications. Nifedipine is a calcium channel blocker. It's also a common medication for blood pressure. Some people feel it slows them down. It makes them have swollen legs. So that is some of the side effects. It can give headache, but it's a very common medication. Amlodipine is his family member, and these are the common medications we use in Ghana. Okay. Nifedipine and amlodipine, very good.
Okay, now let me give you, this is doctor's number. This is not for the show. So since I only have him for an hour, and you have your BP for more than an hour, so you probably would need doctor. It's on 024 5708 001. 024 5708 001. Now, from Monday through to Friday, you find doctor at Kolebu, the first floor medical department, from Monday to Friday. On Saturdays, you get doctor at East Legon, the Heart Clinic. East Legon, the Heart Clinic. It's opposite
the Eco Bank.
The Eco Bank. The
Okonglo
Junction. The junction directly opposite the Legon entrance. If you just come up opposite the Eco Bank, you find the Heart Clinic. You can go there. That's on Saturdays. Monday through Friday, you find Dr. Kolebu, the medical department on the first floor. and then you can go. I mean, that's where you probably need extra assessment to get what's right. But Doc, I think we have to say a massive thank you. Any advice before we let you go?
Well, I think if we look at blood pressure, we should take it serious. If you don't know your blood pressure, please go and check your blood pressure. Number two, if you're doing any of these activities we talked about, not exercising, drinking too much alcohol, taking too much salt, not relaxing, a lot of stress in your life, think twice, try to calm down, try to take things slowly, decrease your salt, start an exercise program, drop the motorbike and use a bicycle, and then walk mostly, and then jog. I think if you do this, it will help.
Well, thank you very much. And Tanti's Fashions, they make my shirts for the show, and you can attest that they make me very, very, very fine shirts. They are on 024-366-2001. This is Tanti's Fashion. This is not Doctor. So Tanti's Fashion, who make my shirts, they are on 024-366-2001. Give them a call. But if you want doctor for your health issues, at 024-5708-001. Thank you very much for watching. And next week we'll be back to do this all over again. Thank you so much. Doc,
thank you.
It's been a pleasure.